When it comes to healthcare, saving time is good as long as it's giving you more time to get more involved in your health or to help your family stay healthy. Welcome to the Inside Scope, a podcast by Lakeland Regional Health. I'm your host, Dr. Daniel Haight, and with me today is Dr. Tony Moon, a family medicine practitioner who's board certified with the Lakeland Regional Physicians Group, and he practices at the Lake Merriam Clinic right there on South Florida Avenue in Lake Merriam. Dr. Moon, welcome.
Thank you for having me, Dr. Haight.
And what I'm excited to hear is that, not only are you a family medicine physician and you do what I love is prevention, you're also behind the scenes with technology and helping us as physicians better connect with patients. Tell me a little bit about family medicine, but then also, what are you doing behind the scenes?
Absolutely. Well, family medicine is kind of my bread and butter. It's my passion. It's what got me into medicine, for that matter, is just being able to sit and talk with patients and get to know their stories. And I have the honor and privilege of treating, parents, grandparents, sons and daughters.
All ages.
All ages. I love what I do. I mean, the stories that I hear and the medicine itself is challenging, and it just keeps me on my toes. And it makes for a fun day.
Well, I love the family medicine aspect of family because a lot of things run in the family.
It does. They do.
And it's not just genetics. It's things that families love to do, certain foods they like to eat, activities they do together. But, the family history, getting to hear the story of not just the person, but the family. What are some family history things you like to hear about?
I mean, if anything, just not only from their background, but the type of food they eat, like you had mentioned, but their medical history. For one, if mom, dad had diabetes or hypertension, or even the coronary artery disease or heart disease.
Things that could run in the family.
Absolutely. And so just being able to sit with my patients and just really kind of understand where they're coming from.
And as you meet more and more patients, it's trying to have the information at your fingertips, whether it's at the clinic visit or 2 a.m. when something sudden has happened, you can have the records right there. Tell me a little bit about what else you do behind the scenes in helping all of our doctors be better doctors.
Absolutely. I also have the honor and privilege of serving as the medical director of informatics for Lakeland Regional Health. It's a big mouthful, but I help spearhead the efforts and to really marrying the IT technology, information technology, and what we do as physicians every day.
Well, we collect lots of information as physicians in order to help, and I think with your help, keeping it secure, keeping it accessible. But there's this brand new thing that has come on over the last few years, and I'm not sure how many folks are using it, but a lot of folks will say, yes, I do. It's the patient portal. And there's other words. How would you describe this that, some folks, we want to actually help anyone in the audience listening today to add to what they already know about the patient portal, but for folks who are new to it, encouraging them and showing some high points. What's another word for some patient portal? What is that?
Well, I mean, the biggest thing is it's a phone app. It's called MyChart. It ties directly into our EMR system, our medical record system, but it also is a point where anyone who can go on their phone and type me a message, access their patient their information, their medical information, and have that information right on hand. And from a physician standpoint, if someone calls me or if an emergency arises, I can access that information on my phone.
And folks will remember 10, 20 years ago, the medical record was a chart. It was basically, it stood as its own. It was pieces of paper all put together. It was filed a certain way, and that chart meant everything because it's there. And what I always love telling patients is that chart is your property.
Absolutely.
That is your information, your medical information. Those pieces of paper are kept in the doctor's office, but you had access to them. You could get copies of it, and it's your chart. But you could only have one chart. One person could see it at a time. I really love this patient portal. It takes advantage of that electronic aspect of it. I think a lot of folks are using the patient portal. They're using it on their home computers? Are they using it on their phones? How are they using it?
A bit of both, but generally on their phones. That's kind of the main access point. I mean, everyone uses our phones. I mean, we use it I used it a couple of nights ago to get a reservation. It was great, but it's so ubiquitous. It's so easy to use.
People are using. Some folks will say, "Oh, one of my family members, they're not technologically inclined," but only to find out they are making reservations for restaurants. They're doing things on the phone because society is actually saying they prefer to do it that way. but the healthcare is so much more powerful. I just think if you want to be an advocate for your own health,
Absolutely.
or
Absolutely.
someone in your family is helping a family member or yourself get connected. So what are some of the advantages of these patient portals? And I think a lot of folks know, oh yeah, I do that, but let's see if we can go through a few of those.
Well, I mean, the biggest thing and the biggest impact that I truly believe that using your phone in the app in the portal system that you had mentioned on is being an advocate for yourself. Is I love it when my patients can have access to their information. So when they come see me in my office, they have an active voice and they can say, hey, Dr. Moon, what does this lab mean? Or what is this? What does this mean in my chart? Or can you expand on this?
So before the appointment,
Absolutely.
they've had a chance to look at maybe the last visit's labs or what was going on test results and x-rays. To me, it sort of starts with making the appointment. And I think that's what's headed in the future is being able to go in and be reminded of your appointment. I like that part that saves me a lot of time.
Same here.
I can answer those questions. And some folks say, do I have to answer these questions again, about my medicines and this and that? Why is that important to do that before your visit?
Well, it allows us, and I can understand it can be a little clunky at times, and even myself, when before I see my own doctor, my own physician, I go, man, why am I doing this again? All my medications are the same. But what it does allow is to make sure and ensure that your medication lists are appropriate. You're taking what you're taking.
Yeah. Has there been any changes?
Has there been any changes? And it allows for a much more robust, a much more just easier visit.
Because you may have seen another doctor and a new diagnosis has been added. Here's your opportunity because you want to talk to your family doctor about the sort of the coordination of all the care. That to me is a big help. And so you're getting pretty much even. I think you can check in. When you walk in. And I just love it where they just say you're already set, you're ready to go, and have a great visit. Oh, that's pretty powerful. I'm trying to think of what are some of the other advantages. Oh well, I knew. Just trying to, maybe I have a question after I left. I have 100 questions to ask, and I didn't get a chance to ask all of them. But now that I'm home, I want to ask one more question. It used to be you'd have to call. So how's that changed? How can you ask a question of your care team?
Pick up your phone, open the app, type in a message.
So where does that message? So I can message my care provider, my physician. Where does that message go? What's happening behind the scenes?
As soon as you hit send or submit or send on that message, it gets routed to our clinical pool, our clinical team.
Yeah.
So we have my staff of nurses and MAs. They'll go through all of the messages, and if it's something simple such as, hey, I need a refill, they can take care of that. Or if they see the message and go, ooh, wait, I kind of need Dr. Moon's their input on this, they route it directly to me, and I have access to it.
So you've actually read the messages when they come in, but if it is sort of straightforward,
it gets taken care of.
Or they might say, "Hey, Dr. Moon, Jane Doe had that question," and you're able to say that's the straightforward answer. And take it there. Well, I guess on the flip side, what are certain things you don't want to communicate via this way?
Well, if it's anything extremely sensitive for one, or if it's something that I think
like chest pain. It's something like serious, like
serious.
I'm short of breath. I've got chest pain. One leg is swelling. It's where messaging versus
face to face
versus going to urgent care. Your office is located there on Lake Merriam and South Florida Avenue at the Lake Merriam Clinic. You're co-located with urgent care.
We are.
Now, that's interesting. It's two different sides of the building. And so anybody can come to urgent care.
Absolutely.
You don't even have to be a patient of Lakeland Regional.
No, anyone who needs services can walk right in and be taken care of.
And then if they are being seen by other doctors either there or at other sites, they have the electronic information to answer questions or know what's been going on.
And that, I think, is like one of the strongest points with using our portal system, our EMR system, is it has the ability, incredibly, to connect with hundreds of health systems all around the United States, even around the world. I actually have a few health systems that I was able to access records from Australia and England. through the NHS system. And so if there's anyone who's from out of town moving to Florida, or who make Florida their home 6 months out of the year when the weather is beautifully warm and not cold, I can access the system and view your medical records, your doctor's notes, your office notes, and even labs sometimes.
Wow. We're even encouraging, if a patient is seeing a physician just outside of the area.
Absolutely.
And these physicians are relatively close otherwise, those physicians can sign on to not the patient portal, but there's a provider portal.
Right.
And this is for doctors and clinics to be able to tap into the records and be able to securely get the information that helps them with their own patients in case they had to have surgery at Lakeland Regional or saw urgent care. So that's huge. I mean, that's a major benefit. What I like about the portal is it brings up so many things to help you be an advocate. The first is, and you and I were talking about this earlier, it's the 4 M's. The first M is like, what's really important to patients? Medications.
Medication.
You see that list of medications on your portal. Is it what you're actually swallowing?
Right.
Please double check. And I know this other thing that we've been really talking to from kids to community groups is to know your numbers. And one of the numbers is, do you know the milligrams that you're taking of a particular medicine? Because there's the low dose, the medium dose, and the high dose. Know your numbers. And so you'll see it there on the portal, but it gives you a chance to double check. If it says that you're taking 10 milligrams, but you're taking it twice a day, is that accurate?
Is that accurate?
And you get to figure out that. And it helps so much if you're developing a side effect or you have a cost question.
Absolutely.
What are some of the other M's that the patient portal can help us out with?
Well, mobility. And mentation are the big ones, but for me,
I know patients are really after medicines. They want to stay mobile, and they want to stay sharp.
Keep this sharp. But to me, honestly, of the 4 M's, is the biggest one is what matters to you. What matters to you, and why? Like, why are you coming to see a physician? Why are you coming to see me? Why seek medical attention?
What's most important to you?
Exactly.
And it could be medications, mentation, or mobility, but it could also be
something else.
I want to be able to do something with my niece or my grandson, and I'm focusing towards a goal. And so what matters most, you have any interesting stories as far as patients that have tried to put all that together, or what matters most?
No, actually, I think one of my favorite patients that I think I see them next week is when he established with me a few months ago. His biggest thing was I wanted to lose weight so I can walk down my daughter's wedding. And we were able to work. He did the hard work. It was up to him. So all the credit. But he lost, I believe, about 98 pounds.
Wow!
And so he's ecstatic about being able to walk without a cane.
Changes in mobility. And then working with that. It's great to see on the patient portal those different items that you can really look at and ask questions. Especially we talked about lab tests.
Absolutely.
And I'm always a little concerned about seeing something on a portal without having a physician right there, but I have Google right there. It is sort of a little bit of caution of what you see in the patient portal. You want to discuss it with your physician because it all came from a physician's discussions with you.
Absolutely.
Because I love this joint decision making of you just don't get a CAT scan or you just don't get a lab test. You talk about it. And you say, now I recommend this, and or do you have any concerns? But when the result comes, I think there can be so much more added by not just seeing the result and seeing that it's high or in red. And then worrying about it, but getting that communication. Do you see that a lot?
I do. And I've always said I firmly believe a patient anybody has access or should have access to their medical records, including their lab results. But the one thing that I do really, really harp on is context. The way that any system because of number parameters, if one value is 0.00001 above, it'll flag red. It's dangerous. It's a critical alert. Right. Or there's something wrong. But the human body is so much more advanced, so much more nuanced and complex that I always tell there's been countless times where a patient came to me and said, "Oh my gosh, my A1C is 5.5. It's in the red.
Yeah.
What does that mean? Do I have diabetes? No,
Yeah.
you don't.
Well, we definitely want to talk about A1C, and I think that, hearing that something is just in the red, and I've actually seen it the other way around. I've actually seen doctors very worried that a patient might see on the portal that their kidney function was doing well, and therefore I don't need to see the doctor. And well, wait a minute, the doctor was probably going to talk about other issues to stay healthy,
Right.
preventative issues, the next steps. And I think that's really important, is not just to look at those labs and say, well, they all look normal, chest x-ray was normal, I don't need to see the clinician. But it's often that those opportunities where the physician may be able to go through some other what's going to happen next, things like that.
I'm a numbers guy. Numbers tell us so much, but at the end of the day, it's it's the human connection.
Well, it's what I tell patients. These are just numbers.
They're just numbers.
How are you feeling?
Exactly.
And especially in the hospital where folks will come in and say, "Well, your white count is improved, and you're this and that." How do you feel?
How do you feel?
And is everything right? And you really want those questions asked. And I think those are the kinds of things where being an advocate for your own health and your family's health
Absolutely.
would be starting with what we mentioned earlier, is know your numbers.
Know your numbers.
And I'd really like to go back to what you just mentioned, hemoglobin A1C. If you're listening to this and you've ever heard of the term hemoglobin A1C, excellent. If you know anybody with diabetes, respecting their privacy, but do they know their A1C? I always get a little concerned if a patient with diabetes has never heard the words hemoglobin A1C. If you have diabetes, you should have heard hemoglobin A1C. And you should almost memorize what your personal number is. Would you agree? I mean,
I do.
If you
Absolutely.
have diabetes. And
I mean, if anyone with diabetes, that is the A1C is the main way that we as providers track how you're doing.
And so to tell everybody exactly what the A1C is, it lets us know how your blood sugars have been doing. It's not just that instant in time.
No, it is an average of 3 months.
3 months. So it's letting you know, and this is funny, I used to have patients that would go in for their diabetes visit, and they would behave themselves very well for the week leading up to their visit, so that if the finger was stuck and the blood sugar was tested, it looked pretty good. But the A1C, you said it looks back how long?
3 months.
3 months, yes. So it's a very helpful number to know, because to me, high sugar, that's irritating your nerves, your eyes, your kidneys, your feet, it's all these things.
We found recently, actually, in that hyperglycemia is the medical terminology for high blood sugar. But sugar in and of itself, or having the sugars, is one of the most inflammatory states in our body.
Yeah.
It wreaks havoc. So if you're a diabetic, in knowing what your A1C is, your hemoglobin A1C is, it's crucial.
Yeah.
But I tell my patients all the time, especially we're only a few weeks out of the holiday season. Christmas, the New Year's, the time with your family, at the end of the day, being able to take a little bit of a break and allowing yourself a little bit of grace, enjoy the Christmas cookie, just one, not two. Enjoy that king cake, enjoy a little bit. But at the end of the day, go right back into a good diet, good lifestyle. Your numbers will average right out.
So the patient portal will show you not just your sugar level, but your hemoglobin A1C level.
Absolutely.
That all diabetics should have an awareness of, and if family is helping somebody with diabetes, it's always good to know, and it's a great question to ask the physician. From the portal, so what are some of the other numbers patients should see when we say this? Do you know your numbers? What are some other good numbers?
So your cholesterol, your LDL, your total cholesterol.
LDL, yep. Okay. So that's the bad cholesterol.
The bad
LDL,
cholesterol.
Yep.
Your HDL, the good cholesterol. Your blood pressures, your CBC, your blood counts.
Yes. And, so that to me just starts a conversation, because it's hard for anybody to remember all these things and what they mean. But if you start hearing it over and over again, if a particular patient has said, your blood pressures are good if they're 120 over 80 or lower, but it's different for each person.
Absolutely.
They may have and then your hemoglobin A1C, you mentioned 5.5, actually pretty good.
It's pretty good. It's pretty great.
10.
Not so much.
Not good.
So much.
Yeah. And so that helps family members and a patient to say, I'm starting to remember now. We've talked about it. It's the third or fourth time. Hemoglobin A1C, I'm seeing it in the portal. And sometimes the portal will graph it out on how you're doing over time. And you could say...
And we have access to that as well. So we monitor trends, we monitor how you're doing. But you touched on this a little while ago. But sometimes if you don't remember what your numbers are, but oh my gosh, they were in the red.
Yeah.
But it opens that door and opens that conversation to have with your provider.
Even if the portal starts showing things are doing really well, going to the doctor might say, okay, I'm glad you came today because we wanted to set up your eye doctor appointment, and things that might silently be going on. And, you may feel great and the numbers may look good, but there's these well-known screenings to make sure, are your nerves working the way they should be? Is your kidneys working? Because sometimes diabetes, high blood pressure, these silent things, and they take their toll on the kidneys and the heart.
They do, and that's when I like to call, especially when I see my patients, is that's the time that I like to have fun, because I begin to nitpick. We've taken care of the major things and got them under control, but it's the little things that you mentioned: your eye exam, your colon cancer screening, your prostate screening, your breast cancer screening. All of these incredibly helpful tools
save lives.
Saves lives.
And I know when we're trying to empower people with this information, it can be a lot. And I love this one question to say to your doctor: I've looked at my patient portal, I see all my issues, but can you tell me what's the most important thing for me right now? And I've heard a doctor say, well, you have heart failure, you have kidney problems, but your blood sugar and your high blood pressure are your number one things today. And then the next question is, well, what are we going to do about it?
What are we going to do about it?
And then the last question is, why is this important? And it is almost a flipped around of what's most important to you in advising me about my health care.
So, I mean, at the end of the day, it's what is important to you. And that's ultimately what drives our visit is, everyone wants to be healthy. And everyone wants to be able to live their lives to the fullest.
The quality of life.
Quality of life. And so at the end of the day, numbers only tell us so much. But there's no substitution. There's no comparison of actually being able to sit with your provider, with your doctor, and say, hey, this is what really matters to me. This is why I'm here.
Yeah, and to me, I think it really brings that partnership together of shared decisions when the patients have now literally at their fingertips a patient portal and can access that information. If they go see another doctor, they can help direct that information to that doctor, or nowadays doctors are now able to tap in, like you mentioned, from across the country, and as we get out there and travel and do everything.
I've had so many patients say, well, I kind of Googled, and at the end of the day, they're amazing search engines.
Yeah, the artificial intelligence that's available,
right?
And it sounds good, but it's not personalized.
It's not personal
100%
to you. And the one thing that the AI, as incredible as it is, the human connection, the human touch.
Yeah.
Doesn't understand it, doesn't know it, doesn't know you, who you are as a person.
Well, let me flip it around a little bit. What we're seeing is that it is not uncommon for the physician to rely on all their years of experience, all their studying and medical training, but will add to it, what does medical artificial intelligence help the physician and the team in the care of particularly difficult diagnoses? And what's your thoughts on this? I feel that is not just using artificial intelligence. It's a physician steering it. And also not believing 100%.
Nope. I use AI in my clinical practice all the time. The biggest one that I use is it helps my documentation. And it allows me to kind of return to
spend more time with the patient.
Exactly.
What I found is it has added my understanding of complex situations and has helped me explain things a little bit more clearer and memorable. I wouldn't want to teach a class and then have the students forget what I said 10 minutes later.
Right.
And so boiling it down to what's most memorable and then repeating it. But I think what we're seeing in medicine is that there's more and more tools. I used to, and if you see this lab coat, it has lots of pockets. It has pockets on the inside, it has pockets on the outside. We used to fill them full of books.
Paper.
Yeah, we used to have mini textbooks that my eyes could not read today. Okay, they were micro printing. Remember the Sanford guide?
Sanford guides.
And these guides that doctors would carry around in their pockets, and I think these were our external brains. Well, we've now multiplied it. But we are using it to the best of our abilities wisely and with the patient in mind.
Absolutely.
How do we make it unique for the patient? It's almost like robotic surgery. It's not the robot doing the surgery. Nope. The surgeon is 100% in control of that robot. It's the same as when we're doing this. It's our responsibility.
It's our responsibility.
Yeah, I think that's very reassuring that we're mixing it together, but it's a great questions to talk about.
But I think one of the things that a lot of people are beginning to understand is the amount of medical knowledge that is constantly being updated and constantly being studied and constantly produced in the world. And so if you think back to like even when I was in medical school, the amount of medical knowledge that we know that was present at that point in time until now.
Yeah.
With our phone,
we would stay up studying till 3 in the morning.
4 in the morning.
Yeah, and now I think there's so much more information and it's so accessible. We want to see it in a very transparent way, and we want to see it prove to me that this is the right recommendation.
Absolutely.
Show me the research that was.
Show me the numbers.
Yeah, both not only ethical research, but it was randomized, it was controlled, and it showed that this was a reasonable conclusion, and that's how we could decide
What's the best
treatments.
treatment.
Yeah, and I'd love to be able to see that at my fingertips.
And that's one of the greatest features of AI in medicine specifically is allowed me to do is keep up to date on the newest, most accurate research being done, the newest guidelines, proven guidelines. But at the same time, I don't wear a white coat. But I couldn't imagine wearing my white coat and having all of that information in paper form.
Exactly. Oh, it'd be just.
I would be crunched over.
My neck would be breaking.
But exactly. We have access to that information right on our phone.
Yeah.
And so it's an incredible tool. But at the end of the day, there's always a physician in the driver's seat, as it should be.
Yeah, and explaining the nuances, because I tell you, everybody's story is unique. Everybody's family history is unique.
Absolutely.
So if a patient is going through the portal and has questions, is there a helpline they can call?
There is. I mean, the main line, 863.
Well, there's the I can't log in.
I can't log in, or I don't remember my password.
Yeah.
That was my mother the other day. And so there's always a main line for here at Lakeland. It's 863-284-5000, and our amazing CL team will be more than happy to help.
Yep.
And it's just another avenue and another tool in our toolbox.
Well, it's really helped because at the Lake Merriam Clinic, your team members, from the receptionist to the medical assistants and all that work in that clinic. Tell me a little bit about your team, having all the good things they're doing.
Oh my gosh, where do I start? I mean, I've always told my staff, and I call them my staff because without them, I'm not able to do anything that I do. So, but from our check-in team to my nurses and my MA staff, I mean, they are the first line. They are the first faces.
I've always seen where they put that little reminder about, hey, it's flu season, or it's just make sure we get that note for work or for school.
Right.
And you're dealing with all those ages. That's the fun part, and then you're able to tie in sort of what's happening in the community and then what's most important to the patient based upon what they tell you.
No, absolutely.
That's excellent.
But like I said, I would not, and there is not a doctor's office in Polk County, in Florida, in the world that does not owe everything they do to their staff. So that's a first thank you to them for putting up with me and my shenanigans sometimes.
Well, I love how Lakeland Regional sort of pulls it all together and has it in multiple sites. And having the urgent care right there.
It's incredible.
And actually the freestanding emergency room is just a little further down the street. That's open 24 hours a day.
Yep.
So, I mean, just to have that access to care. But then you really need to have that healthcare home. And I know that's what you're providing. You have this healthcare home because you get to know your patient so well.
I mean, we try to. At least that's what I say. But at the end of the day, I mean, I'm thankful for the patients that have entrusted me to be their doctor.
That's the best part about being a doctor.
Absolutely.
Nowhere else do you get to ask these very personal questions, but it's for a reason, and it ties it together. And then just to be able to explain, the hemoglobin A1C, it's counting how much sugar is stuck to your blood cells, and that only lasts for 3 months. but it tells us the numbers. And just being able to explain, what's the best advice and get their questions. Dr. Moon, I really want to thank you for all that you're doing and helping us with all the technology, and we're looking forward to working with you some more.
Absolutely. Thank you for having me.
Take care. I've enjoyed it.